Let's talk about the pediatric cranial nerve exam. For a lot of people, this is the most daunting station in the MRCPH clinicals. But it really doesn't have to be. In this breakdown, we're going to give you a simple, step-by-step system you can use every single time so you can walk into that room feeling totally in control.
Okay, picture this. You walk into the clinical station, there's a child. The examiner gives you the instruction, examine the cranial nerves. That moment can feel like a ton of pressure, right? But the secret isn't about memorizing 50 different facts. It's about having a solid framework. And it all starts before you even lay a hand on the patient.
So, here's our game plan for today. We'll start with what I call the 4Ds, that crucial first look. Then we'll work our way logically down, sight and smell, then the face, hearing and the throat, and finish up with the neck and tongue. And at the very end, we'll wrap it all up into a really simple checklist you can take with you. All right, section 1, the first look. I can't stress this enough. Before you ask a single question or perform a single test, the exam has already begun. The clues you gather just by observing are absolutely invaluable. They set the stage for everything that follows. And your framework for this is the 4Ds. First, dimensions. Just a quick glance. Is their growth what you'd expect? Second, dysmorphism. Any unusual features that catch your eye. Third, distress. What's the child's general vibe? Are they calm, upset, irritable? And fourth, devices. Scan the room. Are there crutches, a wheelchair, an inhaler sitting on the table? These are all major clues. Okay, now we get to the hands-on part, starting with the nerves that control sight and smell. Now, this group covers 5 different cranial nerves, so having a really clear, structured approach here is going to be your best friend.
We'll kick things off with cranial nerve I, the olfactory nerve. Look, in a timed exam, you don't need to be pulling out vials of coffee and cinnamon. A simple, direct question to the parent, have you noticed any changes in your child's sense of smell, is efficient and perfectly fine.
So the eye exam involves 4 different nerves. It's easy to get tangled up. Your lifeline here is the mnemonic APFM. That stands for acuity, pupils, fields, and movement. If you just follow those 4 letters, I promise you won't miss a single thing. First up, A for acuity. Start by just noting if there's a Snellen chart in the room. If not, no big deal. You just test one eye at a time for far vision from about 3 meters away, and then near vision at about 1 meter. And if their vision seems poor, you just work your way down the ladder. Can they count your fingers? Can they see your hand waving? Or at the most basic level, can they just perceive light? Next, P for pupils. Now, this is super important. This isn't just one test, it's 2. First, you have the light reflex, which tests nerves 2 and 3. You shine a light and look for both direct and consensual constriction. Then you test the accommodation response, which is all about focusing. As you bring an object closer, you're watching for their eyes to converge. Next up, F for fields. The confrontation test is your go-to here. The key is to sit right opposite the child, at their eye level, about 1 meter away. You test one eye at a time, bringing your wiggling finger in from the outer edges and basically comparing their field of vision to your own. And finally, M for movements. This is the test that cleverly checks nerves 3, 4, and 6 all at once. You just ask the child to keep their head perfectly still and follow your finger as you trace a big H in the air. It's that simple. You're just watching for any jerky movements or lack of coordination. Okay, we've covered the eyes. Now let's focus on the face itself. This means we're testing 2 major players, the trigeminal nerve for feeling and chewing, and the facial nerve for all those expressions. For cranial nerve V, the trigeminal, remember it does 2 jobs, sensory and motor. For sensation, you'll have the child close their eyes and you'll gently touch a bit of cotton wool to the 3 different sensory areas on both sides of their face. For motor, you just feel their temples and jaw muscles as they clench their teeth, and then ask them to move their jaw from side to side. Now for cranial nerve 7, the facial nerve. This is where you test all those muscles of expression. The best way is to just give a series of simple commands. Ask them to look really surprised, to raise their eyebrows. Then ask them to squeeze their eyes shut as tight as they can. Give me a huge smile. Puff out your cheeks. Can you whistle? This little routine covers all the bases. And this brings us to an absolutely critical point, a really high-yield distinction for any exam. If you see facial weakness, how do you know if it's a problem in the brain or with the nerve itself? The answer is in the forehead. An upper motor neuron lesion, like a stroke, spares the forehead, but a lower motor neuron lesion, like Bell's palsy, affects the entire side of the face. Remember that.
Okay, moving right along. Next up, we're zoning in on the nerves that handle hearing, balance, and what's going on in the throat. That means we're looking at cranial nerves 8, 9, and 10.
So cranial nerve 8, the vestibulocochlear, has two parts. For the hearing part, a quick finger rub or a whispered word next to each ear is a great effective screen. For the balance part, you can just observe how steady they are in general. And if it seems appropriate, you can do a quick Romberg's test. We can actually check nerves 9 and 10 together with one simple action. Just ask the child to open their mouth and say, ah. As they do, watch their uvula. A great way to remember this is the uvula points to power. It deviates away from the weak, damaged side towards the strong, healthy side. And just listen to their voice too. Any hoarseness can be a subtle sign of a vagus nerve issue.
We are officially in the home stretch now. The last part of our exam looks at the motor nerves controlling the neck, shoulders, and the tongue. That's cranial nerves VIX and VIX.
Cranial nerve XI, the accessory nerve, is very straightforward. To check the trapezius, you just ask the child to shrug their shoulders while you gently push down. To check the sternocleidomastoid, have them turn their head to the side against your hand. You should be able to see and feel that muscle on the opposite side pop out. And our final nerve, cranial nerve V12, the hypoglossal, which is all about the tongue. First, just have a look while it's resting in their mouth. Any wasting or twitching? Then ask them to stick their tongue straight out. Now here's the crucial part. Unlike the uvula, the tongue deviates towards the side of the problem. Think of the strong side pushing it over to the weak side. And that's it. That is the complete examination from start to finish. So now, to really lock this in, let's just run through a super quick checklist of the absolute must-do tests that will make you look slick and confident on exam day. Here you go, your exam day cheat sheet. For vision, acuity and fields. For the trigeminal nerve, cotton wool test and clench the jaw. For the facial nerve, a big smile and squeeze the eyes shut. For the accessory nerve, shrug shoulders. And for the hypoglossal, stick out the tongue. If you nailed these 5, you're showing the examiner you have a confident, systematic technique. So there you have it, a complete, reliable system for the pediatric cranial nerve exam. You have the map, you know every step. The only thing left to do now is practice, because real confidence in that exam room doesn't come from just memorizing facts. It comes from having a system you can fall back on and trust every single time.